Today we have orthopedic and spine surgeon Dr. Graham Calvert and orthopedic surgeon Dr. James Woodall with Baptist Medical Center and Mississippi Sports Medicine and Orthopedic Center. Thank you both so much for making a house call with us today.
For having us.
Let's talk about your specialties. What is it that you do?
Sure.
We both can treat
Dr.
all
Woodall?
conditions
Yes.
of the spine, anything from degenerative to disc herniations to acute trauma. We take care of all of it.
Now today we're specifically talking about radiculopathy. I want to make sure I say that right.
That's right.
Now I know that it causes weakness, pain, as well as numbness. What exactly causes it and how would you treat it?
That's right. Radiculopathy is basically the kind of pain you get when you get pressure on a nerve that's coming out of your spinal column. So it could be coming out of your neck or it could be coming out of your low back. But typically it manifests as a radiating style pain that starts, for example, in your neck and radiates down your arm. Lots of people will confuse it as pain in the shoulder itself or pain in the elbow or pain in the wrist and think something's going on with their shoulder. They'll come see one of our specialists, one of our partners, who will make the diagnosis that they have more of a radicular radiating style pain and get an MRI of the neck and then send them over to us. But it is one of the masqueraders because it's really pain coming from your neck, but it seems like it's not because it's pain along that nerve wherever that nerve goes.
Now, what would cause this? Would it be being in an accident, an athletic injury? What exactly causes it?
That's right.
So the most typical example would be a disc herniation that puts pressure on the nerve, and then that nerve having pressure on it for a significant amount of time would cause the pain to radiate down your arm or leg.
There's a lot of things that can cause it. I mean, you can get, like you said, a disc herniation. There could be degeneration like bone spurs. It could be even trauma. You could have some sort of trauma and have just some subtle instability in your spine that's just putting pressure on a nerve and causing pain.
Now, what would you do in order to treat someone who comes in and it turns out that they have radiculopathy?
So a mild case of radiculopathy, that patient would typically get physical therapy, anti-inflammatory medications, and depending on how they progress with that, or in a more severe case, they may need surgery. It's a very gratifying condition to treat surgically because you can go and take the pressure off of the nerve, and a lot of times these patients get instant relief of pain and return of their strength and are able to function again immediately.
That's right.
What about steroids? Would steroids be effective with this condition?
Definitely. Steroids can kind of settle it down, and lots of times we'll start off and give people steroids initially through the form of an injection or PO with medications, and I'll give it as almost like a litmus test, because if the steroids really knock back the pain, then usually the pain will return after steroids wear off, but usually it's not as bad. The pain that doesn't respond to a dose of steroids typically is usually from a big disc herniation, and there's a lot of pressure on that nerve, and those are the ones that usually ultimately end up needing some sort of intervention.
Now, I know a lot of times people complain about symptoms that feel like tennis elbow or, even carpal tunnel syndrome. Could those be symptoms that are masquerading as well that could be radiculopathy?
And you always have to look for those two things.
Yeah.
We ruled that out.
Right.
You ruled
That's
that out
right.
first.
The biggest thing is, like we said earlier, it starts, typically radiculopathy, if it's coming from your neck, it starts in your neck or around your shoulder region and then goes down. Whereas carpal tunnel, the one thing I always ask patients is, where does it start, where does it end? In carpal tunnel, the pain usually starts in your wrist and ends in your hand and manifests as night symptoms. Usually people tell you they have night pain and night numbness. Whereas radiculopathy, it doesn't really matter, day or night, it's bothering you.
Now, what about the way you sleep, the kind of pillows you use? Are those effective after you have the treatments and making sure that you're doing what you need to do to stay out of pain?
Certainly, because especially upper extremity radiculopathy depends on the position of your neck. If you move your neck in a position that puts more pressure on the nerve, then you will have more pain. So a pillow that puts your neck in a better position could certainly have benefits.
It can offload.
Now, a lot of us like to self-diagnose too. If you're having pain, especially if you've had it for a while, the best thing to do is what? Come in and get checked out.
That's right. I mean, WebMD and some of these forums, I mean, everybody gets on the internet these days, and there's a lot of good information on the internet. There's also a lot of bad information on the internet, so you have to be careful what you read. But the biggest thing is try some anti-inflammatories, try some stretching exercises. Typically pain that goes on after 2 weeks is usually something from a cause. Any pain that's just going on acutely under 2 weeks, I would try to self-medicate, do some anti-inflammatories, some physiotherapy style things, and see if it gets better. If it doesn't, then obviously seek better counsel.
We've got about 30 seconds. Most people think this is something that older people get, but especially now, anybody can get radiculopathy.
Absolutely.
Is that right?
Yeah, a lot of times it's a sports injury that'll trigger
picking up something too heavy. I mean, that's across all ages right there. So.
Exactly. We hurt ourselves a lot sometimes. Well, thank you so much for being with
Thank
us
you so much
again.
for having
We've been
us.
talking with Dr. Graham Calvert and Dr. James Woodall, and we've learned a lot about radiculopathy. Thank you so much for being
Thank
with
you.
us.
Thank you.